Good afternoon, everyone, and thank you very much for joining us for this Allied Health Professionals webinar. For colleagues on the East or the West Coast of Canada, it's great that you were able to take this time away from your busy day, and for some, it's probably the end of your workday, so we really appreciate it. It's been over a year since our last webinar, and I'm very excited to introduce our presenter today. Hsieh is a clinical pharmacist at the St. Paul's Hospital Atrial Fibrillation Clinic. The St. Paul's AF Clinic is a multidisciplinary clinic that consists of electrophysiologists, a nurse practitioner, a clinical nurse leader, a clinical pharmacist, and an ECG technologist. Stephanie graduated from the Bachelor of Pharmaceutical Sciences program at the University of British Columbia in 2014, and she then completed her one-year pharmacy residency program in Vancouver. She's currently enrolled in the Doctor of Pharmacy program at the University of Toronto, and she's been at the St. Paul's AF Clinic since 2015. Here's Stephanie.
Good afternoon, everyone. Thank you very much for the kind introduction, Jackie. Before I begin, I just wanted to touch on some housekeeping issues. So if you have any questions during this webinar, feel free to type your questions into the chat box. I'll reserve the questions to the end to make sure that we keep our webinar on track, and we'll address it then. Before I start, I'd like to reveal that I have no conflict of interest to disclose. And the purpose of our webinar today is to share our atrial fibrillation clinic's experience with the development and implementation of an amiodarone toolkit and education process. We also want to share with you our patients' feedback on how we can improve this process to further meet their needs. Just a bit of background on amiodarone. Did you know that amiodarone was first introduced in the 1960s as an anti-anginal agent due to its vasodilator properties? It wasn't until later that they discovered this medication was a useful antiarrhythmic agent. Now we know amiodarone as one of our most effective antiarrhythmic medication used to treat atrial and ventricular arrhythmia. Despite its effectiveness, however, its use is associated with many side effects, such as those affecting the central nervous system, the eyes, thyroid, lungs, liver, etc. The prevalence of these side effects have been quoted to be up to 15% within the first year of therapy, and this significantly increases to 50% over longer-term use. That's 50%. This prevalence of side effects highlight the importance of patients' adherence to their baseline and routine monitoring tests as recommended by the NASB guidelines, now known as the HRS, to ensure its safe use. When we looked into the literature to assess real-life practice adherence rates to these monitoring tests in both cardiology and non-cardiology outpatient clinics, we found that, surprisingly, the adherence rates to these tests have been largely suboptimal without further intervention. Rates of adherence ranging from 0 to 41% has been reported. Therefore, I think this highlights an area where there could be significant improvement. Although we didn't assess the adherence rates to the monitoring tests for our patients here in the clinic, before implementing this education pathway and the toolkit, we did see patients started on amiodarone in various settings. So patients would be seen in our clinic with amiodarone that could have been started in the hospital, in their internist office in the community. And not surprisingly, the education that they receive on this medication can be quite inconsistent. There are some patients that come in with some knowledge of the medication, whereas some patients come in with no knowledge at all of the medication, its purpose of use, and most importantly, the monitoring aspect. Identifying this as one of our issues, our goal was to develop a process to ensure that all patients who are started on amiodarone therapy in our clinic are provided with comprehensive education on the purpose of therapy, the benefits of the medication for them, potential side effects of use, and how to monitor for these side effects at home. And most importantly, we wanted to make sure all patients are knowledgeable of the monitoring test schedule recommended with this therapy. By empowering them with this knowledge, we hope that we will be able to improve their adherence to monitoring tests. Something that we wanted to do with this project is also to engage our patients to elicit their feedback on how we can improve this process further to meet their needs. Therefore, to meet our goals, our multidisciplinary team created an Amiodarone toolkit, which is essentially a clinician and patient resource that we can give to patients upon amiodarone start in our clinic. Now, this slide is a brief summary of the different components of what we have in this toolkit. And so, at the top here, we have the clinician resource. So in the clinician resource aspect of the toolkit, we have a prescription template, a GP letter, and an education checklist. The bottom part here, we have the patient resources that we provide to the patients in our toolkit, and this includes the information sheet on this medication, a monitoring test schedule as per the NASB guidelines, and the relevant lab requisitions. In the next few slides, I'll go over each component of the toolkit so that all of you can see what we've included in this resource. First off, when amiodarone is suggested as a therapy to be initiated by our clinicians, so either the EP or the NP, the pharmacist is consulted to go in and provide the education of this medication with them. We provide the verbal information to them, such as the benefits of therapy, the side effects, and how to monitor for them at home, as well as the recommended monitoring test schedule. They are also given this written handout so that it can jog their memory when they go home. Something that the handout doesn't go over in too much detail is the monitoring test schedule as recommended by the NASB consensus guidelines. Therefore, we added an additional component highlighting the tests that are recommended with amiodarone therapy. And so this includes chest x-rays, pulmonary function tests, blood work checking the liver and thyroid function test. In the first portion of this handout, I've listed the tests and the recommended schedule in written form. In the middle portion of this handout, I've listed our clinic's phone number for the patients to call if they do experience any of these side effects. Now I want to focus our attention on the bottom part, the table portion of this handout. So in the lower portion of this handout, we have an amiodarone monitoring test schedule table that we provide to our patients. I'll orient you to this table, much like what I do with the patients when I initially provide them with this toolkit. So on the top row here, I have the dates of the routine tests as per the guidelines. So baseline, 1 week, 4 week, 6 months, and 1 year. And the dates will be added corresponding to when they start therapy. In the leftmost column here, I have the type of tests that is recommended. So we have eye exam, chest x-ray, pulmonary function test, blood work checking for liver and thyroid function tests, and ECG. In the middle of this table, there are some empty checkboxes that correspond to the dates that the patients are supposed to get these tests. So for example, if you look at blood work, baseline blood work is suggested, as well as every 6 months. In between when they're supposed to get these tests, I've also jotted down some common signs and symptoms of some side effects that these investigations are meant to be looking for, so that it jogs patients' memory as to when they should inform the clinic if any of these occur. After the patients are provided with the education and information on this medication, and after we've gotten their informed consent to start therapy, the patients are then provided with the prescription using the template that we have available for clinicians. In this prescription template, there is a section for drug allergies, a section for loading dose, a section for the maintenance dose. And at the bottom there, we also have a section where we can note down any notes on how we plan to manage drug interactions. Now, this last portion was included after feedback from our community pharmacy colleagues when we distributed the initial version of this prescription template for their feedback. Their thought was that since amiodarone is associated with so many drug interactions, and to reduce delays in getting patients started on this therapy, it would be a good idea to include this note in the prescription so that it improves the communication between the clinics and the community pharmacies with regards to managing drug interactions. Following the prescription, we then fill out this GP letter that we will send out to the patient's community providers. This GP letter will inform the community provider of this medication start, the dose that we've started them at, and the ultimate goal for the maintenance dose. We've also outlined the frequency of the test as recommended by the NASP guidelines with the use of this medication. And this is in hopes of improving communication with their community providers to enlist their assistance in helping us ensure that patients are adhering to these monitoring tests out in the community. Lastly, we have an education checklist that the pharmacist will go through to ensure that patients are provided with all the relevant information to ensure their safe use. After this is completed, the pharmacist will write their name and the date, and this will then be placed in the patient's chart as documentation purpose. By going through the different components of the toolkit, I've essentially outlined our amiodarone education process, which is summarized briefly here on this slide. So to summarize, when amiodarone therapy is suggested by our clinician, either the EP or NP, the pharmacist is consulted to provide the education on the medication and to go through how to use the toolkit with the patient. This usually takes around 15 minutes. The patients are then provided with the prescription, information sheet, schedule, and requisitions when we've gotten their informed consent to start. The pharmacist then will go through the checklist to act as a double check to make sure that all relevant information is given to the patients. And then we'll send a letter to their GP to inform them of the therapy start, as well as the recommended monitoring test schedule. Now, we thought the toolkit would be helpful in terms of helping patients adhere to medication, helping them better understand this therapy, but does it really meet our patients' needs? To answer this question, our multidisciplinary team developed a 10-question questionnaire that we administered to patients 1 month after they received therapy and received the toolkit. We chose 1 month as our cutoff so that we can assess their retention and understanding of the amiodarone material provided to them to assess how effective our education was. We analyzed the data by identifying common themes for open-ended questions and calculated out proportions of patients who selected each option within multiple choice questions. We obtained ethics approval for this quality improvement project. So in the next few slides, I'll go through the 3 domains that we were assessing in our questionnaire. The first domain that we assessed with the first 5 questions was the patient's knowledge and understanding of amiodarone therapy after 1 month of receiving the education. Some examples of questions here are, do you know why amiodarone was started for your atrial fibrillation or flutter? A, yes, or B, no. And can you list 3 symptoms of amiodarone's possible side effects that you need to tell us about? And we left this open-ended for the patient to write 3 potential signs and symptoms. The next two questions aimed to assess the patient's perceived compliance to adhering to these monitoring tests after receiving the information on this medication. We also wanted to explore any barriers that they have to adhering to these monitoring tests. Examples of questions here are: how likely are you to complete the monitoring test at the recommended schedule? Very likely, somewhat likely, or not likely. And in terms of barriers, what are some reasons that may prevent you from doing the test? A, I am too busy. I won't remember when to go. It's hard getting to the lab. I don't like needles. E for other barriers that are not listed above, or F for no barriers. In terms of our last domain that we were assessing in the questionnaire, we were hoping to assess or gauge their satisfaction with our current education provided both verbally and in written format. Examples of questions here that we asked the patients include: is the monitoring test schedule handout clear for when you should get the test? Yes or no? And if their answer was no, we provided an opportunity for them to give us feedback on how we can make it more clear. Another question here is: what suggestions do you have to help us improve on our current amiodarone education and handouts? We also collected some basic demographic data, such as their age and sex. As well, we also noted down how we delivered the education, so either via phone or whether they received the education through clinic. Now, this will be important later on as I describe the results. So we started administering this questionnaire in July of 2017 and ended our data collection in October of 2017. During this period, we had 18 patients who received amiodarone with this education process and received the toolkit. 15 of the 18 patients agreed to participate in this project. So of these 15 patients, their mean age were 65 years old. There was a roughly equivalent split between male and female. And on the left here in the pie chart, we've noticed that 2/3 of the patients received the education and the toolkit in clinic, whereas 1/3 of them received the education over the phone. The reasons for them receiving the education over the phone varied. One, which is the most common reason, was that we see patients from all over the province, as well as from different provinces and territories. So we see some patients from the Yukon as well. Therefore, due to geographic distance, it might not be possible to provide the education in clinic, and therefore we needed to do this over the phone for these patients. In terms of our results, when we looked at our first domain, where we assessed their understanding of amiodarone therapy, we noticed the following findings. Most patients who were started on amiodarone therapy in our clinic had no knowledge of this medication before receiving the education here. Some patients had some knowledge, but most didn't. After receiving the education from our clinic, almost all of our patients were able to identify why this medication was started even after 1 month of receiving the education. So we thought we did a pretty good job explaining why this medication was used and the purpose of therapy. 80% of our patients were able to or had sufficient information to monitor for early side effects of this medication at home. And when asked, almost all of them could identify at least one side effect associated with amiodarone that they need to inform the clinic about. Now, this was an open-ended question, so we gathered their signs and symptoms that they've written for us into types or organ types and presented the top 3 types of side effects here identified by our patients related to amiodarone therapy. The most common issue suggested by our patients were those related to the lungs. The second most common one was those related to vision issues. And the third common side effect correctly identified by them were those related to the skin. Thyroid issues were unfortunately only volunteered by around 10% of our patients, and seeing that this is probably one of our most common side effects seen with long-term amiodarone use, I think this highlights that we could improve more on educating them on how to monitor for abnormalities in thyroid function while on this medication. In terms of our second domain, where we assess their perceived compliance and barriers to monitoring tests, almost all of the patients said that they were very likely to adhere to the test after receiving the information. Some barriers that they've listed that may prevent them from doing the test include busy lifestyle. This was volunteered by 2 patients, frequent travel, and not being able to remember to go for the test. And both of these were identified by 1 patient each. In terms of their satisfaction with our current education and information provided both verbally and online or in written format, 80% of the patients thought that the monitoring test schedule handout, where there was a tabular form for helping them keep track of the tests, was clear for helping them, informing them of when to go for these tests, whereas 20% of the patients did not think this monitoring test schedule handout was clear at all. Of the 20% of the patients who said that this monitoring test schedule was not clear, some feedback that they provided us was that in addition to the handouts, they preferred physical phone call reminders in addition to the handouts to physically remind them to go for the tests around the time that they're supposed to go. One person wanted the tests and dates to be itemized instead of being in a table form. So, for example, ECG to be done on November 7, 2018, blood work to be done on March 8, 2019, for example. In terms of our patients' overall satisfaction with the amiodarone education, both provided verbally and in written format, almost all of our patients, 87% of them, were very satisfied with the information that they received from our clinic. 14% of them were not very satisfied with the information that was provided. When we looked at the feedback provided by these 14% of patients, we found that, interestingly, most of these patients received the education over the phone. Based on their feedback, we thought that some of the issues may be related to the timing of when the education was administered to when the toolkit was given to them. So, for example, we were phoning the patients after their visit first to provide the education and explain the toolkit that was coming their way. Then we would mail or email the toolkit to the patients. There might have been some gap between when they received the toolkit and the phone call, which led to perhaps some confusion when they're sifting through the handouts, as some of them thought that the toolkit was quite confusing when they received it and that it was disorganized. One patient among the 14% who weren't satisfied recommended that we spend as much time on the benefits of therapy as well as the side effects of the therapy to prevent scaring future patients away from taking a potentially useful medication. And 2 patients wanted more assistance and information on how to book some of these monitoring tests. So in conclusion, we thought our project identified the following patient needs that we could incorporate into our practice going forward with regards to providing amiodarone education. We heard from our patients that education is most effective if it is administered in clinic, because there's someone to go through the toolkit with them and answer the questions in clinic before they start on this medication. However, because of geographic distance with some of our patients, it's not always possible to provide this in clinic, and therefore we need to explore strategies to improve the education over the phone. Now, one simple strategy could be that we scan the toolkit to the patients first so that they have it in front of them when we phone them to provide the information on this medication. Another strategy to make this easier would be to color code the handouts And alternatively, we could also explore using a video conferencing platform such as Skype to deliver the education. Lastly, we also talked about potentially creating an amiodarone education video available to the patients online. We think this could serve two purposes. So one, for those freshly started on amiodarone therapy, it could serve as an initial education supplemented with the verbal information provided by the pharmacist. It could also have a section where it goes through each component of the handouts with narration. And second of all, for patients on amiodarone therapy long term, this video could serve as a refresher for the side effects that they need to continue to monitor for, as well as the monitoring test schedule, as we know that the prevalence of side effects increases to up to 50% with patients on long-term use. We also heard from some of our patients that in addition to the written handouts, that we also needed to provide physical reminders to remind them to go for these tests. Some strategies that we came up with that won't increase workload in our limited resource clinic would be to start at automated telephone reminders. And for the tech-savvy patients, and you would be surprised that even though our average age was 65 years old, there are some patients in this population who are very tech-savvy. So for these patients, we could recommend the use of free mobile phone applications such as MediSafe or CareZone, where it has the added function of adding in appointment reminders, which could be substituted for blood work, so that their phone can remind them for when to go for these tests. One patient wanted us to focus more or as much on the benefits of therapies as well as the side effects of therapy, so to prevent scaring patients from potentially taking a useful medication, and for some, really the only medication that could be used safely for them, such as the heart failure patients. And lastly, a couple of patients wanted more assistance and information on how to schedule some of these monitoring tests. As you remember back in the monitoring test schedule, not all of these tests could be done in one center. So by providing assistance with this regard can also increase their adherence to these tests. Before I address the questions in this chat box, I'd like to acknowledge the following individuals for their help and support with this project. Jenny McGill of Ray, VGH AFC Pharmacist, for planting the initial idea of providing a package with all the amiodarone handouts for our patients. Jackie Foreman, our CNS, and Serena Kutcher, our CNL, and Belinda Furlan, our NP, for their support with this project. Carolyn Wilson, my pharmacist counterpart, and Sherry Jang, a pharmacy student, for their help in scheduling and administering the questionnaire, as well as the BC AFC Provincial Group for creating the initial GP letter template that I've revised and incorporated into this toolkit. So thank you everyone for your help. Now I've come to the questions component of my webinar. I see some questions here, but feel free to type in any questions that you have, and I'll address them to the best of my ability. If I'm not able to get to your questions, feel free to email me, and my email is available in the biography section, and we can continue this offline. I'm also curious, in addition to questions, as to what resources you folks provide to your patients when you start them on amiodarone therapy. Are there resources that you give them that you find helpful in helping them adhere to the tests? And is there a process that you've developed in your clinic on amiodarone starts? So if you want to type it here, I can read it out so the rest of the group can hear what your experiences are as well. So I have a few here by Timothy Polak. The most difficult patient is the one who comes in with incorrect knowledge of the drug garnered by the internet. Drug names are out of date. I haven't seen a tablet of cortisone in 15 years. Novo amiodarone is now Teva amiodarone, and Gen amiodarone is now Mylan amiodarone. Switching sources does affect absorption, as demonstrated by shifts in steady state serum concentration. I think Timothy brought up a very good point here. Often patients are scared of the information that they read online with the amiodarone. And I find that some of them, we could address some of these misconceptions if we're able to sit down with them, clarify their concerns with starting the medication in clinic, and if they still not want to proceed with therapy, then obviously we can address alternatives. But we found that for most of these patients, we're able to clarify the misconceptions and have them trial the therapy. And surprisingly, some of these patients have benefited greatly from starting the medication. Another question from Lynn. Test schedule. Are these tests ordered per your physician's preference or per AF Canadian guidelines? So thanks for your question. With regards to the test schedule, these are the consensus statement published by the NASB, now known as the HRS, in 2016. I have the title of the document here, and I can provide the reference to anyone who's interested. You can feel free to email me. The title of the article that we've gotten this monitoring test schedule from is titled The Practical Management Guide for Clinicians Who Treat Patients with Amiodarone. The author of this is Dr. Andrew Epstein, and the most recent guideline for this was in 2016. And Timothy, thank you very much for, sorry, I'm just reading this comment. Thank you very much for your feedback. And yes, I would love to discuss with you further offline with regards to your 30 years of experience with amiodarone. So thanks very much. And another question by Lynn. Teaching sheet given to patients with blood test control within 3 to 4 months. Lynn, I'm wondering if you can clarify your question here. Are you wanting us to clarify whether we provide the results to the patients after they receive the blood test? And while I wait for Lynn to clarify, I have another question from Serena. Do you have any future projects with regards to your amiodarone projects? And will you consider a secondary seminar for evaluation and follow-up? So thanks very much for your question. With regards to future projects, we are looking into creating an amiodarone education video for our patients, especially for those receiving the education over the phone and for those on long-term amiodarone therapy. We think this could also be beneficial for clinics who may not have a pharmacist available to them at all times, because the physicians can then play this video to patients in the clinic with questions that can be addressed later on if they have any. In terms of secondary evaluation or follow-up, I haven't had any plans so far, but an idea did cross my mind that perhaps after revising the toolkit, we could administer the survey again to see if there's any improvement in response after the revision based on patients' feedback. So I got a clarification from Lynn. She's saying that AF patients followed and called for control, so I'm assuming that they're called to remind them to get the blood test. But there is a lot of patients not followed, which is a big concern, and I agree with you. The toolkit is a great idea and should be implanted across all hospitals. I agree. I think after we've revised the toolkit, we have looked or thought of looking into implementing this potentially in other clinics and the inpatient side, so that pharmacists can use this as a tool to starting patients on amiodarone therapy as well. So thank you, Timothy, Lynn, and Serena, for the questions and your feedback for this webinar. Thank you, everyone, for joining us today in the webinar. If you have any questions, feel free to email me. My email is shsieh@providencehealth.bc.ca. If you think of anything that you'd like to share with me, I'd be happy to discuss this offline further with you. And again, just want to to thank everyone for their attention and for sticking through the whole presentation.